Every day, more than 130 people die in the United States after overdosing on opioids. What if you could save a life? This video will walk you through how to administer Narcan, an overdose reversing drug. Dr. Mark Calarco of American Addiction Centers explains.
First of all, we want to make sure that they're not just asleep. So the first thing you would do is come up and say, "Hey, are you okay? Hey, are you okay? Are you awake?" If they don't respond, then you want to go ahead and take your knuckles and kind of rub it on their breastbone or their sternum, because that's a little bit irritating and usually wake people up when they're in deep sleep. If they don't respond, the next thing you want to do is go ahead and see if they're breathing. So get your ear really close to their mouth and see if you can feel or hear any breathing. If they're not breathing, the next thing you can do, if you know how to, is to go ahead and just look for a carotid pulse right here. The final thing to do is to look at their eyes, see if they have, check their pupils. If their pupils are very pinpoint, if they have pinpoint pupils, and if they're not breathing, and whether or not they have a pulse, with or without, it gives you very high risk of suspicion they might have overdosed. The next thing I would do is make sure the person is on their back before you administer any medication. And then you're going to go ahead and you have Narcan available. We're using this nasal spray because it's very easy for non-trained people to use. It's very easy, just like a nasal spray. Just peel the back, leave that, you don't need it, and then pull out the nasal spray. It's just like an allergy nasal spray. On your dominant hand, use your index and middle fingers on the top, and your thumb here is to push the medicine when you're ready. You want to go ahead and insert it in either one of the nostrils and make sure their head is back a little bit so you can see. You can even touch their nose slightly if you need to. Insert it in here and then use your thumb and press it all the way in. And then you want to turn the person on their side, what we call the recovery position. And what you're going to do is you're going to go ahead and have them bend their leg like this so they don't lay on their stomach, and turn them on their side. The reason why we do this is because if they do wake up and they are recovering from an opioid overdose, they can vomit, and we don't want them to aspirate. The next thing you do is you monitor them. If they don't respond, or they become awake and then become unconscious again, you could administer another dose of Narcan every 2 to 3 minutes as needed until help arrives. Some of the very powerful narcotics that are out there, such as fentanyl, are 100 times more potent than heroin. And when you give Narcan, it'll reverse the respiratory depression and it'll start breathing. But the drug's so powerful, it'll re-exert its effect, and people can go unconscious and stop breathing again. So you need to monitor that. Right, so Narcan or naloxone, which is kind of the generic name for it, basically what it does, it knocks the drug, like the opioid, whether it's heroin or fentanyl or oxycodone or hydrocodone, any of the opioids or opiates, it knocks those drugs off the receptors that cause respiratory depression. And in doing so, it allows the person to start breathing again. That's a great question. So this is one medication there. It really doesn't do any harm. So if they aren't suffering from an opioid overdose, it will have no effect. And the side effects from this medication are very minimal. So the chance of you harming them is very low. But the chance of saving their life is far greater. This is only effective if someone has opioids in their system. It doesn't work for any other drugs. But oftentimes people use other drugs of choice, like methamphetamine or cocaine, but in these days, many of those drugs are laced. In fact, most of these drugs are laced with fentanyl. And so the risk for overdose is great, regardless of the drug they're using. Yes, now by law, all prescription medications have to have an expiration date. However, if you're really wise and smart, and for the benefit of the people you love and people in the community, if you carry around naloxone for who knows what emergency reasons, and you discover that your naloxone is expired, but all of a sudden you have somebody who you're concerned might have overdosed from an opioid, I would still use it, because most of these drugs are potent far beyond their expiration dates. just like carrying an EpiPen around for one of your loved ones or anybody you might meet who would have need, I would say I would love to see everyone in the country carry around naloxone or Narcan, because you never know when you're going to need it. Now, in several states, you can obtain it without a prescription. It varies state by state. Some require a prescription, some require a pharmacist to dispense it. I think that is continually evolving, but for the most part, I would say, depending on what state you're in, I would go ahead and inquire with a pharmacist and see what they say.
While reviving someone from an overdose may save their life in that moment, what happens next? We know that addiction is a disease, and left untreated, it will only get worse. But there is help available at American Addiction Centers. You can call 1-866-53-SOBER. That's 1-866-53-SOBER for more information. You could be the lifeline to save someone's life.